PSA, prostate-specific antigen, marker for prostate cancer. Also elevated in BP8, benign prostatic hyperplasia, and prostatitis, used for monitoring recurrence after treatment. Screening utility is controversial due to false positives. USMLE Question 1. A 68-year-old man presents for a routine checkup. He has no urinary symptoms. Digital rectal exam is normal. His PSA level is 6.2 nanogram per milliliter. What is the most appropriate next step? A. Start finasteride. B. Transurethral resection of the prostate. C. Begin antibiotics empirically. D. Repeat PSA in a few weeks. E. Immediately proceed to prostate biopsy. Correct answer, D. Repeat PSA in a few weeks. Explanation: an isolated elevated PSA without symptoms may result from transient causes like recent ejaculation, prostatitis, or BPH. Rechecking the PSA before proceeding to biopsy avoids unnecessary intervention. A. Finasteride reduces PSA but is not first line without BPH symptoms. B. TERP is used for symptomatic BPH, not asymptomatic PSA elevation. C. Antibiotics may be used if prostatitis is suspected, e.g. with symptoms. E. Biopsy is invasive and should follow repeat confirmation of elevated PSA. Now USMLE Question 2. A 72-year-old man with a history of prostate cancer treated with radiation 3 years ago now presents with rising PSA levels on routine labs. He is asymptomatic. What does this finding most likely indicate? A. New onset BPH. B. Acute prostatitis. C. Prostate cancer recurrence. D. Bladder cancer. E. Normal age-related PSA increase. Correct answer C. Prostate cancer recurrence. Explanation: in a patient with prior prostate cancer, a rising PSA after treatment suggests recurrence and warrants further workup, e.g. imaging, oncologic follow-up. Why not the others? A. BPH may increase PSA, but prior history of cancer makes recurrence more likely. B. Prostatitis would usually cause symptoms like dysuria or pelvic pain. D. Bladder cancer is not associated with elevated PSA. E. PSA naturally rises with age, but in this context, recurrence is the priority concern.